So we've mentioned how common fecal incontinence or accidental bowel leakage is. Now let's talk about what can be done for this. First and foremost, looking at the stool diaries, if the stools are loose, then it's important to improve the consistency of the stools. Our goal is to make them into that level 4 on the Bristol score, which as you can see here on the score, we want to be somewhere in the 4-5 range, where it's a nice sausage-like stool that hits the toilet and doesn't break down. So to do that, dietary modification is important, improving the food items. If there's some food allergies, then to understand what these allergies are and to avoid those food items. At the same token, giving certain motility agents to help with improving the stool consistency. So for example, despite dietary modification, if the patient still has loose stools, then we can give a loperamide or Imodium, low dose, escalating dose, so that the stools are well formed. And as the stools get better formed, we get to that 4-5 range. And once they're well formed, then that itself may be enough to take care of her stool incontinence. So it is so important to understand that before we embark on any medical treatment, diet is critical in 2 ways. One is improving the fiber in the diet to make the stools bulky so that they are well formed. At the same time, figuring out, is there anything that in the food that bothers me? And if it is an allergy to food or something that provokes increased bowel contractions, then avoiding certain food items, especially even caffeine, can bother the bladder. Then, once the stools are well formed, gradually increasing the fiber. Don't increase it suddenly, such as Metamucil or FiberCon can increase it gradually, a few grams at a time, so that you don't get bloating and gas, and seeing how that does. And then adding a medication such as loperamide could also help with improving the consistency of the stools. Once the stool consistency improves, many patients will notice improvement, and that may be the only thing that is required. If not, we can go to the next step.